Do you find imposter syndrome is almost universal amongst new vets that the new career professionals you deal with?
I think so. I mean, I think that's definitely a common sentiment from students, from new doctors, even from like some that have been out for a while. Sometimes you get hit with it every now and then when a weird case comes in. And even for me, myself, I think the biggest thing for me coming out of school was like, am I ready for this? Like, can I do this? Like, how am I going to do this? So for me, it all just started as just making sure I did my homework every day. When I saw cases, like figuring out, the style I wanted to practice, figuring out how I wanted to approach certain types of cases, and even how I was going to talk to owners about specific types of cases.
One thing about veterinary medicine you think that would shock the average person?
How many end-of-life conversations do we have?
Oh, yeah.
Or I'll give you another one. Sometimes how rude or off-putting some clients can be. Much pets play off of the behavior and energy of their clients. That's another one. And one of the reasons too why sometimes we, try to let clients know that it may be safer for us if we apply a party hat, for those who know what a party hat is.
So would you rather do a physical exam on an alligator or a 3-pound chihuahua?
I'd take the alligator any day, man. I'd take the alligator any day.
Good. I mean, man, because, those chihuahuas, whoo!
Man.
Woo. There's some of them that are, you either have the ones that are just absolute amazing, and then the other ones that are land sharks, and there's no in between.
Yes.
There's no.
Yeah, no, not at all.
What you're going to get. Veterinary medicine isn't just about pets. It's about people, values, and truths we carry when the exam room door closes. Today on Irreplaceable Truths, I sit down with Dr. Christien Bolden, Tuskegee graduate, Louisiana veterinarian, mentor, podcaster, and creator of More Than a Doctor. He's a man of strong faith, integrity, and resilience, willing to talk about things we usually whisper about in the profession. Together, we'll explore imposter syndrome, mentorship, faith, and practice, and what it really costs to stand out on integrity in a world that often asks you to compromise. This is more than an interview. It's a conversation about truth. Dr. Bolden, welcome to the show.
Thanks for having me, Doc. Thanks for having me. It's a pleasure and a privilege as well to be here.
We've been trying to put this together for a while.
Yeah, we have, but we finally got it nailed in, and like I said, I'm excited to be here, man. I'm excited to be here.
Yeah, so Tuskegee grad, you're my second one. I really love talking to Tuskegee. Actually, no, excuse me, you're my third that I've had on the show. And I really love talking about Tuskegee. Tuskegee's a phenomenal university with a lot of history. What does Tuskegee mean to you when you think about that school?
What does Tuskegee mean to me? It kind of brings me back to like my undergrad days, and just like we all call it like Mother Tuskegee, because it nurtured all of us at whatever stage and age we actually went there and matriculated through. And I think for me it was I guess you say kind of like a beacon of light, so to speak, because my first experience at Tuskegee was when I was in high school. There was this program, and I think it's still in effect today. It's called the Vet Step program, and it's a summer program they use for like high school students, to expose them to agriculture, to veterinary medicine, to STEM, so to speak. And we spent a week on the campus. We actually got to stay in the dorms, and they had different like wet labs for us, different activities and trips. And that was my first experience there. And that was my first time actually seeing veterinarians that looked like me. And from then on, it was kind of like, oh, that's where I want to go to vet school, because I had this, of course, a lot of us had this childhood dream to be a veterinarian. And that was my guiding light, so to speak. And then once I actually got there for undergrad, it toughened me up. It helped me to grow up a little bit faster. No, not a little bit faster, but it helped me to grow up and become more disciplined and responsible. And then once I actually got into the veterinary program, that's where the grinding and the foundation was built, so to speak. And you know, I think for me, like I said, representing being a beacon, but also too a chance at realizing the dream of becoming a veterinarian. And I think that was like my first why. I think when I think about what my why is, it started as one thing, but over time, as I've grown, as I've experienced new things, as I've learned new things, it's changed over time. And as I've gone through life changes, whether that's getting married, having kids, it's changed with me. And I think that's something that we should all be open to, is our why at a certain life stage and season of our lives can be one thing, but as that season changes, the why can change too. And I think the one thing that I think that students and just anybody in general, we should always be open to the changes that life is going to bring us, or anything that life is going to throw at us, because sometimes it's going to require us to pivot or require us to have a different perspective to be able to handle and push on through to learn what we need to learn in that season, but also to get through to the next season.
So can you take us back? What was your life like before college and vet school?
Before college and vet school, so I grew up in New Orleans. So I was from New Orleans, born and raised. Went to high school at Edna Carr High School, which has since become a football powerhouse. We won quite a few state championships. I think they're trying to beat their on a championship run now. It's actually my 20th year high school reunion this weekend. So I'm going to be down there this weekend, spending some time with friends, some who I've seen recently, some who I haven't. So that's a big thing. I think when I think back about that time, it was my path in vet med was a little bit untraditional, because I didn't really find myself in a veterinary hospital until I was in undergrad. So I started at the Audubon Zoo in New Orleans, which is our, that was one of our big things, exhibits. That's where I started, but we also have a very the Aquarium of Americas in New Orleans as well. So those were our two, if you want to call it like conservation or zoological centers. And I started in a internship program. It was called the Junior Keeper Intern Program, where middle school and high school students, they came in to teach us about, conservation efforts, about animal handling, visitor programs, those things. So what we did was we went in, we did almost like mini presentations on animals, and talked about where they're from, why they're endangered, the importance of making sure that we're protecting them from, going extinct, and so on and so forth. And that's kind of where I got a lot of my animal handling skills from, just initially, because like I said, we had everything from like rabbits, ferrets, to like huge snakes like Burmese pythons. We had alligators, turtles, bearded dragons, like Egyptian spiny tail lizards, up to like goats, sheep. We had some not cows, but they had, and I'm thinking in the petting zoo, we had donkeys. They had a mule in there. They also had a cow there. And even going a step further and even more into like specialty areas, we had like I spent some time on the exotic bird exhibit, in the Louisiana swamp exhibit. So just different things there, and that's where I really kind of honed a lot of my skills. And when I look back at it now, even my communication and public speaking skills, a lot of it started there, because I was thinking, even before I started getting into social media and things, I was like, I've been practicing for this my whole life, unbeknownst to me. You know what I mean? Because even when we go into the clinic and we go to see a patient, we're communicating and giving on a presentation. We're presenting what our findings on their pets. And then once we present our findings, we present them with a treatment plan. So I've been practicing this all throughout my life, and like it hadn't really clicked until like not recently, but a few years ago. It's like, man, like I've been wanting to do this for forever. So it's all come to fruition now, so to speak, man. So it's been a long time coming. I've enjoyed the journey. There's been some ups and some downs, a lot of learning experiences, but overall, I don't think I would change anything, man. I think everything happens for a reason. God puts everything and everyone in place and for our good and for our benefit is something I've always believed in. It's always held true for me.
So would you rather do a physical exam on an alligator or a 3-pound chihuahua?
I'd take the alligator any day, man. I'd take the alligator any day.
Good. I mean, man, because those chihuahuas, whew,
man. Whew.
There's some of them that are, I mean, you either have the ones that are just absolute amazing, and then the other ones that are land sharks, and there's no in between.
Yes.
There's no.
Yeah, no, not at all.
What you're gonna get.
Not at all.
Yeah. Were there any roadblocks you ran into along that journey?
Roadblocks. I would say my first roadblock was probably just the application process for vet school, because like in undergrad, I had my struggles with organic chemistry and even like a little mishap with the registrar where they lost some paperwork because I had put in the slip to drop a class, but for whatever reason, the registrar's office, the bursar said they didn't get the slip, so I still had a class on my transcript that I hadn't even gone to the whole semester, like most of the semester. So I had to retake the class. Nevertheless, needless to say, but when I was applying, I didn't think my GPA was high enough because I think I might have had maybe like a 3.0 or so, or something like that. And I was like, I wasn't even gonna apply because I'm like, I'm not gonna get accepted, because I mean I was gonna apply to like LSU, Tuskegee, of course. I mean LSU because it's my home school, and maybe like one other school. But I was like, you know what? I'm not gonna even apply because like I need to like do a master's and like get my GPA up or something for. But I talked to my advisor at the time, my academic advisor, Dr. Bolden Tiller. Shout out to Dr. Bolden Tiller. She's still at Tuskegee, and she was like, boy, if you don't just apply, she said the worst thing they can say is no.
Exactly.
So she was right. And she was like, she said that she was gonna write one of my letters of recommendation. She's like, I know you've been doing research at the goat farm. We'll get Dr. Okiri. He'll write you one. And I know you have at least one veterinarian at home that can write you a good letter. And she was right. So she helped me with my application, got everything in, and I got everything in. And I got it turned in. When my letter came, there was I didn't get admitted directly into vet school. At the time, there was it's a program called SERP, or the Summer Enrichment and Recruitment Program, and the program was to help prep those that were getting ready to go into the veterinary program, and also to kind of help boost the applications for underclassmen that were going to apply maybe like the next year or the year after. But at the time, the stipulation was you go into the program, you perform well, and if you perform well enough, that we'll take like the top, I think it was like the top 10 or 15% into the next incoming class. So that is in that program, we basically it was like first semester, first year, condensed down into 8 weeks, basically. So we took like everything from like anatomy, physiology, histology, clinical pathology, like all those beginning ologies, virology, everything, in like 8 weeks. But for whatever reason, the summer that we took it, it got shortened to 6 weeks. I think they may have got short some funding that year. So we still did the same amount of coursework in 6 weeks instead of 8 weeks. And so like that's where I learned how to study. And so I bust my tail those 6 weeks, and I got my letter at the end saying that I had got into the incoming class of 2014, and that was all she wrote after that.
Yeah, I think that's all you need in virology is like 3 days, but that's just
yes,
that's
indeed.
just me
yes,
when
indeed.
it comes to that. So that's SERP. Now that's a Tuskegee thing. That's SERP class.
Yeah, it's programs that they have specifically at Tuskegee, but over time I've seen that there are other schools that offer similar programs. A lot of them, I'm not sure if completion guarantees entrance into the class, into the next class, or a future class, but it looks a lot. It helps your resume and helps your application if you do one of those programs, because it does like two things. It introduces you to the school, to the campus, to the professors, and you kind of get to experience what it feels like. You get a feel for what the coursework is like, what the tests are going to be like, because we took tests in the program as well, and that way you get to see, okay, what's going to be your response to it, but then, okay, how do I make a change or an adjustment to make sure that I'm, where I need to be, to make sure I'm up on everything, and I'm well prepared. So I mean, I think it's an amazing program. Like I said, it's still in effect today, but I think they may kind of do things a little bit differently than when I was there. But yeah, it's I think it was a great opportunity for me and even some of my fellow classmates, because it was some other, of course, other students there who made it in with me in that class as well.
Well, I think that CERT program would be great if they would concentrate on the soft skills.
Yeah.
I mean, emotional control, emotional intelligence, learning your professional identity, teaching them the emotional demands of the profession, how to handle stress, what's going to give you professional sustainability, all those things I think that are truly lacking in the hard skill education that we go through, the hard skill boot camp for 4 years.
No, you're right. Right. I mean, I agree. I mean, I think in some of the programs, they may not have enough time, but I definitely feel that there's space for it in the curriculum, like at large, for sure. Because like you said, like having those soft skills, that's the big thing I think they're lacking. And I think honestly, the soft skills will take you a lot further than all of the technical skill work will, you, to be honest. Like it really will. Like being able to relate to people, being able to communicate with people, and having good bedside manner. I mean, like those things right there, it'll set you apart from, like, anyone else that could potentially be, someone that you're competing for a job or vying for a job against, like with. So it's there. I say those type of skills, they really are like, you can't put a price on them. They're priceless.
They will also change your Google reviews from 2 stars to 5 stars, your Yelp reviews from 1 star to 5 star. I mean, yes. If you're able to relate and show empathy towards the client, then you become the expert, even if you don't know what the heck you're talking about.
Right. Because I mean, you could always learn a new technique, or like learn how to perform a different kind of surgery. You know what I mean? You can't. It's easy to do that, but I mean, the real challenge is, like you said, being on your toes and knowing how to be a chameleon, and when you're working with and talking to different people, back to back, you know what I mean? Being able to, like you said, just relate is what it's like a night and day difference.
Yeah. How do you go from a puppy exam to a euthanasia to a hit by car? I mean,
right.
That typical day, that's not unheard of. Unfortunately, it happens way too often, but how do you emotionally control that? It's hard. It's hard. And that leads to one part of the burnout that everyone talks about. So, and then, when we talked at first on the phone, you were talking about how your faith drives you. How has your faith helped you when you felt that vet med was overwhelming?
I harken back to one phrase. I mean, it's from a verse, and I'll paraphrase it just as I'm thinking of it now. It's that God won't put more on me than what I can handle or what I can bear. He'll always be the strength that I need to continue to persevere through. So I mean, that's one thing I always say. Is like, and even when I'm in the clinic and I'm having one of those kind of days, I'm like, yeah, maybe it kind of sucks, but it's like, it's not nothing that I can't handle, nothing I can do this. I can still do this. Like I can make it through this. I've had and seen worse. So this is not, it's something that's gonna like, cause me to have a breakdown or to like not be able to finish the day. You know what I mean? It's you're gonna have those moments. You're gonna have the tough moments, and the thing is, every tough moment, it makes you stronger and it prepares you for, whatever else that you may see that day, or maybe something, a few months or even a year from now.
Have you ever felt tension between your faith and your professional career?
I don't think so. I mean, and not that I could really put my finger on, because I mean, I look at it this way. It's a privilege that I get that I'm in this position. Like, I'm blessed to say that I get to help people by helping their pets or their furry four-legged family members, so to speak. I think that's a blessing because not a lot of people can say that. They can do something that they're passionate about or something that they've dreamed about since they were a little kid. And I always look at, like, when I go into an exam room, I always look at it as this person is bringing their pet in, that is their family member. They're bringing their family member in. What is the best way that I can help them understand what's going on and help them to the best of my ability and what means they have. Like, I always look at it like that, but on the flip side of that is, how would I want someone to treat and communicate and handle me if I was in that position? So I always go in like with that mindset, because at the end of the day, that's something my parents always told me is, treat others in a way that you want to be treated. And I tell my sons this now, like,
the golden rule.
It is because I can't tell you, I mean, you've heard the stories too of like, oh, I took them, to such and such place or to see such and such doctor, and they just didn't seem like they cared. They were, they didn't explain anything. They seemed to be a little like rude or, nonchalant and, blah, 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 blah. And it's like, I never want any client that I see to feel that way after, coming to see me. And I've always kept that with me, and it's paid dividends. I feel like it's never steered me wrong, and I still get clients that rave about me and always ask when I'm coming or when I'm going to be there, because they want to set their appointments when I'm there.
Yeah, I mean, absolutely. I mean, and the funny thing is though, and I agree with you 100%, but I'm going to play devil's advocate for a second. Have you ever had that client that came in and said, they didn't explain anything to me, they didn't tell me anything, and you look at the record that they came in with, and it's like all the communication that they had with them
is there.
That's a red flag. That's a red flag. You got to be like, either they're not listening,
right,
or how they explained it didn't make sense to them. It's like, because you got to make veterinary medicine at a 5th grade level when you're explaining.
No, for sure.
But I've had that too, where I'm like, I'm sorry, Mrs. Jones. They it looks like you had 13 phone calls.
Right.
But there's always two sides to every story. But I agree with you. I think a majority of the time, especially now, you have new clients come in. They're like, I felt like a number.
Right.
They didn't care about me. They didn't. But I also want to keep in everyone's mind too, that sometimes is a red flag. If they come in and say, you're the 3rd veterinarian I've seen for this problem, red flag, refer to specialty.
Right. I'm already getting nervous. Nervous.
But I'm so freaking competitive. I'm like, yeah, you're right. Let's figure this out, but that's just me.
Exactly. I'm the same way, because I'm like, okay, like if they went through this person and this person and we still at the same spot, it's either, like you said, they're not listening or not following the directions, not doing the follow-ups. It's something missing. Now, could the places that they went, could they have not been the nicest, or maybe they didn't explain things as clearly or break it down as much as they could have? It's possible, for sure. But it's like, something is up, bro.
Exactly. The skin never got better, and they gave me this bottle of antibiotics, and it's still half full.
Yes. It's like, okay, well, we can start there.
Exactly.
Oh my goodness.
Man. So when you think about veterinary medicine right now, and this is a multiple choice organic chemistry question, just kidding. It's a multiple choice question for you. What do you think veterinary medicine needs more now? Compassion, perseverance, or humility?
Can I choose D, all of the above?
You sure can.
There we go. Yeah. Now I think, I would definitely say all three. We need a healthy dose of all three. I mean, compassion for clients. I think even compassion for colleagues, and from like more experienced to newer, younger, less experienced vets and vet technicians. Just because we were all there at one point in time. And there's that stigma of like, oh, you have to grind, you got to get it out the mud, and you have to like put in your time. I mean, yes, they do have to put in time, but who said there's a specific way that time has to be spent? because when we were in that position, we would have wanted somebody to take some time to spend with us, to help us through those moments, and not like grill us or, add on top of that. And I think perseverance for sure, because this is a hard job. Like, and it's the one thing I tell students now is spend time. I think one of the reasons too, and whether, for better or for worse, why schools harp on hours of experience is because they want you to know what you're getting into. And if you're just kind of doing this, easy breezy, oh, I go spend some time in the vet clinic maybe once or twice a month, like you're not going to really see what you need to see to kind of, to know if this is for you or not. And then I would say humility, because again, like once we make it through vet school, we have that diploma and we're in that position, we shouldn't, like there shouldn't be like a holier than thou kind of mentality where we think we're, above and beyond and better than our colleagues, clients, just because we know so much more information on this particular subject. That doesn't make us better. That just puts us in a better position to help and to serve.
Yeah, I mean, and once you do get your diploma, honestly, that's where all the training really begins.
No, exactly. I totally agree.
I mean, that's there's very few that come out and are ready to run. I was blessed. I thought I was. But then again, you talked about hours of experience. I had 5.5 years of veterinary experience, starting as a kennel boy to being the practice manager. I had great mentors where I worked. They knew I wanted to go to vet school, so they were teaching me how to talk to clients, how to treat the staff, all those things that you learn. Unfortunately, you learn the hard way. You learn exactly where you messed up. You have to be humble and apologize, whether it's a staff member or, another colleague or even a client. And I think, at least when I went through vet school, they said apologizing means you're guilty. And I think the mindset has changed from that. But there's nothing to show empathy and be like, you know what? I am so sorry.
Right.
You're human.
Exactly. Yeah. And the one thing that I will add to that in school for us was they told us that it was okay to say you don't know. Now, they also told us too, that's not the end of the sentence or the end of what you say is, so I don't know, but I can find the answer for you. And you make sure that you hold yourself to that. And because the thing that I've seen, like even in my own experience, is when I've said that to clients, and then I actually came back with the answer or with the response or with like the next step, they remembered it and they trusted me that much more because they knew I wasn't trying to just sell them a wolf ticket or like treat them, like we said before, just like another number. And I know that's endeared me to clients over the years as well.
Yeah, I used to just text specialists on the phone. I mean, it's so important as a new career vet to go learn who the specialists are. Keep the phone numbers of all your professors, because while you're talking to them, you're like, I'm not sure about that, but I have a specialist here on my phone. Let me see if I text them if they get back to me. And, whenever that text does come back, exactly, communicate it to the client, and all of a sudden you're the hero.
Yep.
Just like that.
Exactly.
It's a game. I know that's a bad word to use, the game, but you got to learn how to play the game. And,
right.
And that's what it is.
Yep.
And, when we talk about that, saying, I don't know, integrity is probably my biggest value. What does that mean to you as a veterinarian? If someone says you're a veterinarian with great integrity?
It's a good question. To me, how I would look at it is, did I operate or speak or care for my clients in a manner that I give it to them straight. Like I know how to, even in the face of potentially bad news, I won't dress it up in front of them. I'm going to be honest. I'm going to be upfront, and I'm going to let them know exactly what we have and what we need to do. Within that, I also tell clients when I speak to them about, especially if it's a situation where it's more emergent or we need to do more aggressive treatment, I'll still give them options if they need options, because I know, everything is getting a lot more expensive, but I'll tell them, you look, this is what the gold standard would be. But we can also do this and see how we respond. We can always, we can always go to the next level, given this, depending on the situation and, how urgent it may or may not be. But, I'm always willing to work with clients in the best way that I can. That's going to work for them in their particular or specific situation.
Have you ever been pressured to compromise by a boss, a client, or the profession?
I don't know if I would say pressured specifically, but there have been instances where where I've been put in situations to change or alter my protocol. And typically on those, like, I stand firm. I'm like, look, and I would say it probably comes more from the clients, honestly, than from like a boss, I'd say, because sometimes it's because, whether the client has the money to do it or they don't, they may just not want to. They only want to spend a certain amount, and I'm like, I'm not going to. And I've had situations where I guess you could say bosses had been okay with what the client wanted to do, but I wasn't okay with it. So I was like, look, if we're going to do this, this is the way that I wanted that we're going to approach it if I'm going to do it. Because at the end of the day, and I tell students this all the time, if you feel uncomfortable with something, you can say no, or you can defer. I say typically most mistakes or mishaps, most of the time they happen when you do something that you're not comfortable doing or that you're not used to doing. So if there's a specific way that you do things and you don't typically have any issues, stick to that. Yeah, and that's what I've always tried to do, because the times when something has happened or we had a complication, it's typically a time when I kind of deviated from what I would usually do. So and it hasn't been too many times I've done that over my career, and typically it's not something detrimental, that where it's gonna be like life threatening or something like that. But still, in all, it's like I always stand firm on any protocol or procedure if I'm going to be the person that's doing it, because at the end of the day, that's my license on the line. You know what I'm saying? And I'm not going to threaten that for anybody. So I was like, if somebody else wants to do it a different way, that's fine. I don't have an issue or a problem or a qualm, but let's let that person take care of it and not me.
And the reason why I asked you that question is because obviously in Colorado, they pushed through the technicians being able to do surgeries. But
I've seen that.
But the veterinarian's license is what's on the line. How does that make you feel? Would that be anything that ever interested you?
I would say initially no, but like I would have to see where the real edge or reward or like the practicality of it to see if it really made sense. Because just like you said, if the veterinarian that's over everything is license is on the line, I mean they're at a higher risk. And the thing about it is when I've read a couple of those articles, and a lot of the things that they would be theoretically allowed to do, spays and neuters, that's what we have the most complications on.
There's nothing.
So it's like that to me, and that's just me. You know what I'm saying? Is that's all I'm saying. That's all I'm gonna say. I whether it's right or wrong or good or bad, like. Is it gonna free up that many veterinarians to not do a few spays and neuters? Is it gonna be worth it at the end of the day? I mean, we'll know when we know. But to me, I find it hard to I don't know.
I would say I find it hard to trust. I mean, I only trust myself. I trust my wife. She's a badass veterinarian, but that's about it, right? I mean, it's hard. I mean, now if I had a licensed tech that's been working for me for 20 years, and I know that, and I know they would be good, maybe. But if you ask my licensed techs that have been techs for 20 years, they don't want that responsibility.
True, I could imagine question. Them not wanting it.
Yeah. Well, here's a true false for you then. Do you ever walk into a spay and go, "Oh, it's just a routine spay"? True, false.
That is super false, because they're all different. Oh my gosh, that's like, and that's the thing. It'll be one thing if it's like a skin patient, or even like a vaccine appointment. I mean, of course, that if they're gonna do something like that. You know what I mean? Because I don't know, bro. It's
Yeah.
uh,
Yeah. Well, you know what? Let them do their first 140-pound 7-year-old lab spay, and
oh my
then
god,
we'll talk
that's
about
in
it.
heat. That's in heat on top of that. Oh man.
Yeah. So tell
Yeah,
us
I'm
about your
not.
podcast. You got a podcast that you did. You created More Than a Doctor, right?
Yes, yes.
What message do you try to send to your listeners with that podcast?
So with the More Than a Doctor podcast, like my soul, like the biggest thing is, and I guess this comes into like my new why now. Like I said, like I stated earlier, my why has changed from initially just wanting to realize a childhood dream, and it's changed due to helping people by helping their furry, four-legged, and scaly and feathery family members, and now it's kind of morphed into making a bigger impact on the veterinary field at large by helping students and new doctors to give them more perspective, more insight, and more guidance along their paths. Because I mean, at the end of the day, I'm only one person. I can only see so many clients, so many pets. But if I can share my experience and what I've learned, and also to share the experience of other seasoned clinicians and veterinary professionals with the next generation and those veterinarians and technicians of tomorrow, that's me casting a wider net and making a bigger impact on the field at large, and of course on the community that encompasses it all together.
Do you find imposter syndrome is almost universal amongst new vets that the new career professionals you deal with?
I think so. I mean, I think that's definitely a common sentiment from students, from new doctors, even from like some that have been out for a while. Sometimes you get hit with it every now and then when a weird case comes in. And even for me myself, I think the biggest thing for me coming out of school was like, am I ready for this? Like, can I do this? Like, how am I going to do this? So for me, it all just started as just making sure I did my homework every day. When I saw cases, like figuring out, the style I wanted to practice, figuring out how I wanted to approach certain types of cases, and even how I was going to talk to owners about specific types of cases. But over time, I mean, as you see them, and you get some guidance here, some mentoring there, some tips here, so something interesting there, you put it together. I mean, but I think with the podcast, what my goal is to try to shorten that learning curve to help make them a lot more comfortable and confident a lot earlier on, so they're not second guessing themselves, or having those moments where they just where they may be depressed or just really like let down because they think that they may not be doing a great job.
Did you ever feel like an imposter when you actually were mentoring somebody?
I don't know if I would say I felt like an imposter. I guess I was more surprised by when more students started asking me to be a mentor. But then as like time went on, and as I started to nurture the relationships, we all have something to teach. We all have something to give to the next generation, because at the end of the day, even if you're just 1 year or 1 month ahead of somebody, you have a experience that they think that could be helpful for them. And even if you're at similar levels, what you went through to get to that point still may be different than what they did, and you guys could potentially even help each other.
Did you ever learn anything new from the people you were mentoring?
How much new material and protocols has come out since I've been out of school? So definitely that, and they try to teach me some new slang here and there.
Yeah, new slang. Yeah.
Yeah.
Yeah. When it comes to like technology, are you all in with using new technology? And how much do your mentees come out knowing more about the new technology than you do?
I'm always open to new technology. That's something I learned at my first job. With the doctor that I worked for. He's a older guy. And he was really good at what he did. And his thing was, if he can use it and it'll help to grow the practice, he'll invest in it. And I've kind of taken that with me. So I mean, when it comes to like new technology, as for whether it's testing, whether it's certain type of diagnostics machines, or even like, I guess now the big thing now is like AI. It's finding out how we can use it, not rely on it, but just use it to bolster what we already have. And I think the students now, what I'm seeing is they're definitely taking it up a level, or taking it up a step by using it, using the different things that are coming out, just to help them be better prepared for the tests they're going through, for clinics, even for once they get out in the practice, is the big thing that I'm seeing. And I'm like, man, I said, this is different for me, because we didn't have access to all of this stuff when I was in school. Man, it's like the amount of information and resources that they have now. Oh my bro! Like, if we had this when I was in school, it would have been a different ballgame.
So speaking of which, have you, obviously medical records are the bane of every veterinarian's existence, right? Because it's your legal living document. Do you use AI to help you write up any of your records yet?
I have not as of yet. I mean, most of the places I do relief at now, I mean, some are still. I have one that's still paper. I mean, they're like half and half. They're kind of like, there are some paper, but then they kind of aren't. But the other ones are mostly, paperless, and they kind of have a system that they use. It's not AI generated or anything like that. So, but it's pretty straightforward. Like, I mean, there's a lot of templates, and then you kind of just interchange whatever information that you need, depending on the case and the type of exam that it is, whether it's like annual versus sick pet versus like puppy boosters, so on and so forth.
Yeah, because I use the little Plod. ChatGPT created this little Plod device. You can either put it on the back of your phone, or now they have one that's a necklace. And you just go in there and you just record the entire conversation, and you come out and you hit transcribe it, and I copy and paste it into the records.
Oh wow!
So there's nothing. There's nothing that I didn't miss in all my client education and stuff.
Okay.
Obviously, it's not in a SOAP form, but I'm like, it's all in there. Just read it. It reads like a story. That's all you got to do. I always, because I mean, obviously, when paper records, no one can read my handwriting. So overnight went completely paperless in 2007. And I do go into practices now with relief work, and I'm like, you're looking at these, how they're writing up records, and it's just like, there's such an easier way to do this than what you all are doing. And I mean, because granted, we all want to leave the office. If the office closes at 5, yes, we want to be in the car at 5:02. That's a given. But a lot of times people, they have to sit there and write up records for 2 hours.
I remember days like that.
Oh,
right. Yeah, I remember days like that.
Trust me, I'd rather be there at 7 or 8, still trying to save animals than writing up records any day of the week.
I agree. I totally agree.
So, yeah. So what's the newest piece of technology you've worked with or played with?
I mean, I guess some of the new lasers that they have, not the surgical lasers, but like therapy for like, whether it's
arthritis,
we using it for arthritis, or like muscles, or like skin issues that they have. We got that. I think there's another piece. It's something by a company, I think Zoometica, that's got like a visual like vitals tracker, where it's a I don't know if it's some kind of like sensor, or it uses a camera to to like watch the pet, and it'll keep track of like heart rate and like movement and like stuff like that. That's a neat one. I mean, I've seen some clinics that have it. Some of them use it more than others. I'm trying to think of what else. There's a newer, I think is that IDEX? I think IDEX has got something new that's coming out for it's like a newer version for like skin cytologies and biopsies. I don't know if it's all the way live yet, but I know they demoed it a couple of times. I've seen at least one demo for sure of that. So I'm kind of
it was a clinical pathology slide reader. I had the first one in the United States, And I was so excited. I'm like, holy cow, I can just do an impression smear of the splenic mass and I'll know exactly what it is within 2 hours. But of course, my internet speed was crap and it took like 9 hours to upload the slide.
Oh my gosh.
So technology is amazing when it works.
Yeah.
But I love that. I love the urinalysis sediment machine that, it can pick up bacteria
Oh
and
yeah.
crystals and all that stuff. I mean, it's made life so much easier. I'm surprised that no one hasn't come out with an in-house fecal analyzer like that.
Right.
Boom.
That one. That's the one.
Yeah, it's just a matter of time. Everything's getting better all the time,
Yeah, definitely.
Have you ever questioned whether or not veterinary medicine was worth it?
I'd say I feel like I probably have at a certain point, and I think it's probably during one of those times where I was experiencing like that, whether it's compassion fatigue, burnout. But I think I think at that time, and even when I try to reflect now, I think it's been about just realizing or having the presence of mind to realize the season that I'm in and realize what I need for this particular season. Because I've had times where I physically needed to scale back on the time I was spending in the clinic because I was wearing myself too thin between work, between home, between family, between just giving myself like the time I needed so I can be what I needed to be for the people around me and at work. And, in addition to that, and I think even in those times, I mean, like I said, veterinary medicine has definitely been a gift because it's allowed me during those times to scale back, but still not miss a beat as far as being able to take care of and provide for my family. So, I've had moments, but they were fleeting only because I just needed to
reset
and reprioritize what was most important.
With all those things that you mentioned that you had to balance, how did you find the time to refresh or, recover from a day?
Like you mean, how do I find it on like a daily base or at a specific time in those times?
Yeah, I mean, during those times, I mean, it's hard. Like, you're just getting out of school and then you were married and then you had your twins and then all of a sudden all this huge bag of commitments pop up, right? How did you find the time? Because obviously you know how to revive yourself and reset yourself, but what did you learn worked best for you?
I do better when I set specific time up for me to have like quiet time, whether that's reading, whether it's praying, whether it's meditation, whether it's working out, whether it's just having a day to myself during the week when my wife's at work, my kids are at school, and I just take that for me.
A staycation.
Like, right, not even a staycation, but it's just like today I'm just gonna relax. I'm gonna chill. I might get a little bit of stuff done around the house, but like something that is gonna pour back into my cup. You know what I mean? So it's realizing that it was me realizing that I needed that consistently in order for me to be like to the level to the standard I hold myself to. So even on a day like today, I didn't have to work today. I brought my kids to school. I came back home. I got picked up a couple of things from the store that I knew my wife needed, that we needed for the house. I came back. I worked out. I had some kind of quiet time, meditation time for me to kind of, pray. I read a little bit and kind of got my mind right for the podcast today. So it's realizing that you need that time, and it can look different for everybody, but making sure that you gift yourself that on a consistent basis, because if you don't, you're gonna wear down. You're gonna be pouring from an empty cup, and when we're doing that, we're not gonna be the best version of ourselves, to ourselves and for those that are around us.
Yeah, Yeah. Well, I'm honored that you took time off to get ready for this podcast. I guess I should come up with some organic chemistry questions for you.
Nah, that is okay. That is okay. That is okay. Trust me.
What's
And I
the
mean, like I said taking off, but I mean, I didn't take off specifically for today. I mean, I've been off the whole week, honestly. So, but like I said, that was me looking like treating myself in perpetuity. That like I knew that I needed time, to like just to replenish, like you said, to recharge. I knew I needed time to do that, and me just making space for it in my calendar to incorporate it. It was the thing.
What's the one thing about veterinary medicine you think that would shock the average person?
How many end of life conversations do we have?
Oh yeah.
Or I'll give you another one. Sometimes how rude or off-putting some clients can be, unprovoked. I think I'll give you another one. This will be 3. How much pets play off of the behavior and energy of their clients. That's another one.
Yeah, that's a big one.
Yes, a really big one. And one of the reasons too why sometimes we, try to let clients know that it may be safer for us if we apply a party hat, for those who know what a party hat is.
Well, and it's funny too, because it makes me think of, the people that bring in their dog for anxiety, or they both have anxiety. Like, this is my therapy dog for anxiety. They both have anxiety.
Right.
The dog's sitting there shaking. The owner's sitting there shaking. The owner's on like their 5th cup of coffee from the coffee bar in the lobby,
Oh my goodness.
Oh my gosh.
Yeah.
Man.
Yes.
I always, and I love, because unfortunately I'm a Jewish guy, but I'm not of strong faith. But I always have to ask people who have strong faith, because I admire it. But do you ever have a hard time balancing your faith with science?
I don't think that I do. I don't think I've ever really had an issue, or I don't know that I haven't had the issue, or it just hasn't seemed like it's kind of like they've crossed each other. Or I think my belief system and how I look at things, they're cooperative parts in a sense. Because like I said, I mean, science was created by people, but God created people. And there's discovery and changes and updates. All these things are like gifts and talents that that we were given. You know what I mean? And it's up to us to manage it in the best way for not only ourselves, but for those around us, for future generations, and so on and so forth. So the way I look at it, it's like one begot the other, and you can't have one without the other. And one doesn't move independent of the other in addition to that. So I think that's why for me it's never really been it's never become a big thing, or like a contradiction or contraindication for each other.
Is there a mistake you've made that still keeps you up at night? Every veterinarian has at least one. You even know that you still remember the single minute of the patient.
This one was actually like the big one that's coming to mind. I mean, not like it's not a lot of them that I can really think of that really come to mind. Is one on a family dog that we had, Boston. It's my wife's dog, actually. She had him when we started dating. He had always had this small little darker growth, like at the medial canthus of his like, what eye was that? Left eye. Had it for like a long time, never had any issues. We decided to remove it when we were in vet. This was right before the pandemic. We decided to remove it when I had brought him in just for routine dental. did blood work on them, X-rays just to check, make sure everything is cool. Removed it, no issues, no problem. I put it in a formalin jar, but I never sent it off. 6 months, fast forward 6 months, he's like losing weight, not really eating. I took him into my mentor's hospital in New Orleans. We did chest x-rays, mets everywhere. And I'm like, bruh, like what the hell? So and so it always makes me think that did I cause that like to happen, or was it already gonna happen anyway? And like, even though I know that if it was gonna happen, there was nothing I was gonna do that was gonna be able to prevent that. But like, it still sits with me now because I know how much he meant to my wife. Because he was with her through like a really tough time before we started dating, and that was like her soul dog, or not like that was her soul dog. So I know that hit her really really hard. That hit her really really hard when we had to let him go.
Well, it was the first baby, right? That's what it all
Yeah.
comes down to.
Yeah, definitely.
Yeah. But we all have those cases. You still think about them.
Yeah.
They're still in the back of your head. You don't ever forget about them.
No.
And if you do start forgetting about them, that's probably when you do have a problem. Because I've interviewed some veterinarians for my dissertation, and I asked them questions about like that.
Mm-hmm.
And it just blows me away when they're just like, "Oh, I did the best I could." Really? That's all you could say? Not like, where's, you got to know what these clients are feeling, and you got to let them know exactly how you're feeling as well. And that's how you build that doctor-patient relationship that's trustworthy. And you will then get clients that will go in front of a bus for you.
Yes, I couldn't agree more.
Last question. What's one irreplaceable truth you would like to tell the listeners about veterinary medicine?
One irreplaceable truth about veterinary medicine is the pet owners and the clients. The reality that even though a lot of people think they go into veterinary medicine because they want to deal with animals and not people, these pets are connected to people. So at the end of the day, even if you're not a people person, you still need to know how to communicate and comport yourself in a way where you can empathize, where you can relate, and where you can build that relationship.
I'm just laughing because I'm thinking about all the vet students, at least in my class, that went into veterinary medicine because they hated people.
Right. Yes, indeed. But it's like I said, that is an irreplaceable truth. So you're never gonna get away from people.
Every four-legged patient,
in that aspect.
Every four-legged patient comes in with a two-legged checkbook.
Yeah, exactly.
Well, Dr. Bolden, it's been great talking to you. Where can people look you up if they're interested on your socials?
So I am on Instagram. We're on TikTok and on YouTube as well. Our podcast, again, is the More Than a Doctor podcast. That's where we are on socials as well. And we're on all major streaming platforms.
Yeah. Well, from Tuskegee to a Bayou vet, I can't thank you enough for being here today. I'm just bummed it took us so long to get together, but I'm looking forward to working with you in the future for sure. And then I also want to thank the listeners for listening. And if you have any questions, you can always hit me up on my DMs, Irreplaceable Truths, or even better, VetMed HQ across all the different socials. Until next time, we'll talk to you later.